Now focus on the coronavirus situation in the country, and a study by the Ministry of Health and the Kenya Medical Research Institute KEMRI suggests that the wave of infections in Mombasa could have hit the peak sometime in July and in Nairobi sometime last month. It, however, cautions rural counties, particularly in the Rift Valley, Eastern and the North, to brace for a surge in infections.
Eunice Omolo has the details of the findings and why the country's disease burden was much lower than was anticipated.
Has confirmed the first coronavirus case.
On the 13th of March 2020, Kenya announced the first COVID-19 case. But a report by the Ministry of Health and the Kenya Medical Research Institute, KEMRI, confirms that the novel coronavirus was already not new in Kenya. In fact, there were some cases of COVID-19 from as early as February, 3 weeks before the country announced the first case. The study shows that 4 out of 10 people in the major urban cities have already been infected with COVID-19, but also paints a positive picture for the two major urban cities, Nairobi and Mombasa.
Quite a number of African countries have already hit their peak, and Kenya is no exception. We are within that peak.
The findings suggest that the wave of infections could have peaked before the end of July 2020, 2 to 3 months ago. The rate of new infections in semi-urban counties neighboring Nairobi, that is Kiambu, Kajiado and Machakos, and those on the border with Mombasa, that is Kwale and Busia on Kenya's border with Uganda, also peaked before August 2020. Kwale County, neighboring Mombasa on the Tanzanian border, is predicted to have been the first to reach the peak in May 21st, 2020. The rate of deaths from the disease is also suspected to have peaked in August. The report, however, says the infection rate is predicted to still be rising in other more rural counties, mainly in the Rift Valley, Eastern and Northeastern regions, and could peak within the next 2 to 3 months. In March, the government moved to shut down international borders, schools, restaurants, bars and nightclubs, and imposed a nighttime curfew to stem the spread of the virus. But the study suggests that the measures have not been as potent since the number of infections was nearing the peak. The study says the rates of infections in Kenya have been quite high, almost comparable to Europe and the US. However, the disease was less severe, with much fewer deaths reported. According to the report published on Thursday, while non-reporting and a younger population could have played a part in this, it also suggests some kind of population immunity against severe COVID-19 in Africa. By the end of December 2020, there will be less than 1,000 deaths in Kenya cumulatively attributed to COVID-19.
Of course, we will get another peak if we change things. If we stop doing the things we're doing, we are certainly going to get another peak, and we don't know how high that peak will be.
In the last 24 hours, 136 people tested positive for COVID-19 out of a sample size of 3,707. This brings the national count to 35,020. 99 patients have recovered, bringing the total number of recoveries to 21,158. Unfortunately, 5 people succumbed to the virus, bringing the death toll to 594. Eunice Omolo, NTV, Nairobi.